So again, going back to the key components of electronic health records, what we see is that the access to these records is immediate, and it can be both focused on the personal level, the individual level, as well as the population level. It allows for decision support to take place, as well as support improving the efficiency of healthcare delivery. So here is what we see. I wanted to provide you with some more up-to-date information than what is actually in the book. In the textbook, it based most of the statistics based on 2008 data. This is information from healthit.gov, which goes through the information, the most current information about electronic health record adoption in the United States. So this is 2014 data. In the textbook, it says something like only 40% of hospitals in the United States have a basic electronic medical record system. What we now know, because of the HITECH Act being passed in 2009 and many of the incentives that were put in place because of the Affordable Care Act, now 3 out of 4 U.S. hospitals have an electronic medical record system, and that they've rapidly been increasing because of these incentives that have been created for hospitals to be able to get federal funds and state-based funds to fund the creation of their electronic health record systems by demonstrating something called meaningful use. And you're going to learn a lot more about this in the Management of Information Systems in Healthcare class. But just so you have a brief introduction, the reason why so many U.S. hospitals have been adopting electronic health record systems is because there have been significant incentives put in place by the government for hospitals to adopt them. And what hospitals had to show was that, in fact, they were engaged in what was called meaningful use of the healthcare data and healthcare information systems put in place. And so as a result of that, it reduced the financial burden on providers and healthcare systems to put those systems in place. Now, of course, the benefits of electronic health records are significant. They save on unnecessary testing, which means reducing healthcare costs. They reduce medical errors, and ultimately, they have been shown to improve health outcomes. There are some important barriers, which is what the HITECH Act and the Affordable Care Act attempted to do by making changes into the amount of investment on health records, including reducing the barrier of capital expenditures, and that there was, for a long time, an uncertain return on investment, right? So this was a significant investment that was being put in place by providers and health systems, and it wasn't clear that there was going to be clear cost savings. Moreover, the investment in electronic health record system isn't just a one-time event. You have to be constantly testing and refining and putting improvements in place for electronic health records. So that's been, again, when you're looking at the return on investment or the upfront capital cost to build a health record system, it is worth knowing that it isn't just these one-time costs, but that in fact the use of an electronic health record system will require a significant investment, not just in the system, but in IT professionals to run that system. And that had been one of the big barriers to implementing electronic health records, and is still a barrier for many solo practitioners or small group practices when they look at the cost benefit of putting in place this system versus not. There have been, as I said, some significant incentives as a part of the federal government's effort to really put in place a sophisticated and somewhere down the road interoperable healthcare information technology infrastructure. And so the HITECH Act was part of the American Recovery and Reinvestment Act, which created those incentives for physicians and hospitals to put together these information systems and to show that they were engaged in the meaningful use of those systems. Now, of course, having all of this patient information flying around on the internet in these electronic records raised important concerns about patient privacy and confidentiality. And so significant work has gone into ensuring that electronic medical records cannot be hacked, and that people will not have inappropriate access to private health information. Now, as many of you know, the Health Insurance Portability and Accountability Act put significant privacy and confidentiality protections in place for consumers back in 1996. But with the advent of electronic health records, what we saw is that personal health information was much more portable, much more easily to be left on a thumb drive, now that there were thumb drives, to be left in a laptop that could be stolen. And so what HIPAA required was putting in place pretty severe penalties, which incentivized healthcare organizations and health systems to ensure that private medical information would not be lost or could not be stolen. More recently, of course, there have been significant breaches of personal health information on the part of hackers hacking into databases at Anthem and other health systems. And so now, one of the most rapidly growing areas in healthcare is actually looking at health privacy, security, cybersecurity, and ensuring that personal health information cannot be hacked or stolen by people who might want to use it for nefarious ends. Under the HITECH Act, we saw a significant expansion of HIPAA. More stringent rules were put in place about who could access personal health information, including restrictions on vendors and subcontractors who were also now forced to comply with HIPAA. We also saw that there were significant restrictions on the use of health information for marketing purposes. If information was going to be used in the context of research, that in fact patients have to now consent. You can't just simply use the patient's information because it's in a health record for this purpose. You actually have to go back and get consent. So you actually have to go back to get patients and get consent for the use of their personal health information in the context of research. And it also limited the ways in which genetic information and the results of genetic tests could be used by insurance companies as part of information sharing between insurance companies, medical records, and the process of insurance underwriting. It also granted patients the right to receive electronic copies of all of their personal health information, which wasn't really clear in the law before. The question of sort of who owns your health information or who owns your medical record has been one that has been hotly debated in the last 5 to 10 years. And ultimately, where the HITECH Act came down on this and actually put protections in place to say that, in fact, you own your health information, you own your electronic medical record, even if it's housed within an electronic medical system, you have the right to receive those copies. Now, there are lots of parameters in which healthcare organizations can use that data for quality improvement, can use that data for educational purposes, but they can never prevent you and say, no, we own, as Hospital A, we own your electronic medical record. All patients have a right to all health information about themselves at any time. We've also seen a significant revolution in healthcare information technology related to the use of the internet and mobile devices. Now, you have to remember, the internet didn't exist until the early to mid 1990s, and we didn't have mobile devices until the mid 2000s. And so the significant revolution that has happened in terms of the availability and the mobile storage and use of health information has been astronomical. What we see is that now patients can become active participants in their own health and in their own healthcare delivery, because we can go on Google and we can try to diagnose ourselves. We can find out about new treatments. We can read about clinical trials. That was something that wasn't possible 20 years ago. We also know now that there are a wide range of online support communities for people who have diseases and disorders where people can share information. So it's really allowed for patients to become their own advocates in their healthcare. What we also see is that there's a much higher level of empowerment of patients in the physician-patient dynamic, because the information isn't all one-sided. Before the internet, before all these online support communities and the use of mobile devices for healthcare, physicians and other healthcare providers had all the power. There was a huge amount of information asymmetry. Patients couldn't, unless they went to a medical library and poured through paper copies of medical journals, get access to information about their condition and about potential treatments for their conditions. Now, all of that is available all across the internet at patients' fingertips. And so it really has empowered patients and changed the physician-patient relationship, because physicians can now be questioned about their treatment recommendations. Providers can be asked questions about, well, can I try this alternative therapy, or would acupuncture help? I read an article on the internet that said that it might help for this condition. That wasn't happening 20 years ago. And so that's been a really huge shift in terms of what we see happening in the healthcare industry, in terms of how patients interact with providers. What we also see is that there have been the advent of new ways of delivering healthcare as a result of the internet and mobile devices. We see e-health as being another big innovation. So healthcare delivered over the internet via telemedicine and access to your own electronic health record through things like MyChart, for example, which is Epic's consumer product. What we also see is mobile health, so use of iPads and iPhones and other devices for transmitting information from provider to provider or for patient to provider. We even now see sort of a move toward e-therapy. Many of you probably get the same ads I get on Facebook saying, would you like to meet with a therapist on Facebook or via your mobile device? So there are many different ways in which you can engage in therapy via the internet. I got an email a few weeks ago from Anthem Blue Cross Blue Shield saying I could, for just $49, meet with a healthcare provider over the internet and have my consultation done, not in the office, but on the web via computer. So now virtual physician visits are really becoming something that a lot of health insurance companies are promoting. The advantages for consumers are, of course, there's no wait time. It's very convenient. It's very accessible. You don't have all that delay in terms of appointments. And on the provider side, or on the insurance company side, there are also significant advantages, because we live in this kind of on-demand society, right? So people might be more likely to utilize healthcare services if they didn't have to wait or try to schedule an appointment during a time they're free. You can just call up your physician on your computer, meet with them, and talk to them. It seems like a win-win, right? There may also be some downsides to some of this technology that needs to be explored. But I think some of these innovations as a result of the internet and mobile devices are really going to revolutionize how we think about our interactions with providers and what it means to see a provider in the healthcare setting. What we see, of course, is a significant increase in telehealth and telemedicine. And usually these terms are used interchangeably, but there's an important difference. So telehealth is a much broader kind of umbrella term that includes education that's happening, research, other administrative uses or sharing of data. This could be clinically oriented, but it also could include other providers other than physicians. So this telehealth would include things like the e-therapy, online activity, as well as information sharing for research, online health surveys, etc. Telemedicine is much more specific. It's specifically the delivery of healthcare and medical treatment by providers in an online setting. So that's, again, a very fine distinction, but an important one to keep in mind. Some of the barriers to the adoption of telehealth and telemedicine, traditionally the biggest one has been a lack of reimbursement, an inability for providers to be able to bill and get reimbursed for these kinds of services. That barrier has almost now been, in the last couple of years, completely erased. And how you know that's erased is the example I just gave, which is my health insurance company is sending out emails saying that they will provide me with access to a provider through the health insurance plan to get access. And so those visits are obviously, and that care is going to be reimbursed and covered by my health insurance company. So the reimbursement piece has almost been overcome. The other aspect is, of course, is it cost effective? We don't know that telemedicine is going to result in better outcomes, that it's going to be more efficient. Depending on the kinds of conditions in which telemedicine is being used, it may be cost effective, it may not. The only one for which it has been conclusively demonstrated is teleradiology, right? So you don't have to have a bunch of radiologists sitting in the basement somewhere waiting to read scans. You can just zip those scans off to some remote place, whether it be overseas or whether it be somewhere else in the United States, have those reviewed and have those reports sent back. And so not every single health system has to have a huge radiology department, because that can be outsourced through teleradiology. So that has been something that has been cost effective. There are, of course, two kinds of telemedicine. There is synchronous or real-time, things like telesurgery, or where people call in and get diagnosed and get assessed and triaged for cardiac conditions. This is kind of real-time or synchronous. There's a lot of other asynchronous uses of telemedicine, such as teleradiology or telepathology, where information is stored and forwarded to someone else. The recipient reviews the information later. It's not live. So those are the various kinds of telemedicine that we use in healthcare today. There's also something that's talked about in the textbook, which is the use of smart card technology. This is the use of a card that has, as you see in the diagram here, a metal chip, which retains all of your health information, all of your utilization data that can be accessed by providers. In the United States, this is a technology that really hasn't caught on yet. There's been a lot of concerns about privacy. What if my smart card is stolen? But I will tell you that other countries, such as Germany and the UK, have already adopted this technology. When I lived in Germany, for example, I had a card that looked just like the card at the top right, that had a little chip in it. And when I went in, as the diagram on the bottom right shows, I went into the doctor's office, I handed them my card, they put the card into a card reader, and immediately the medical secretary knew the last time I had been to see the provider, my diagnoses, all of my current prescriptions, when I had filled those prescriptions last, because everywhere I accessed the healthcare system, I had to use that card, and it was put into a scanner, and that chip was then encoded with whatever transactions I engaged in. And so it was a great way to have all the information all in one place, and for my provider to be completely up to date about the information. So that wasn't an issue that we have in Germany that we have in the United States of interoperability or sharing information across health systems. It didn't matter how many different providers I had gone to. It didn't matter how many different pharmacies I had used. That smart card had all of my healthcare encounters all encoded in that metal chip. And so there wasn't the issue that we have here in the United States, that if one of my providers participates with Middlesex Hospital only, and I'm in a different electronic medical record for Middlesex versus Yale New Haven Hospital, we didn't have those issues because everything is in that card. So there would be some significant interoperability and cost effectiveness and reducing of redundancy and enhanced information sharing if in the United States we could adopt these smart cards. However, what we've seen is that there are some major privacy concerns that have held back their adoption. We also see that there are significant needs for remote monitoring at home. So this is an use of example of telehealth, where particularly for older adults, but many times for people who are housebound and have multiple chronic conditions, the use of remote monitoring at home allows for things like vital signs or blood pressure or cardiac function to be monitored and to sent back to providers who then can give feedback to patients about changes to their medications, changes to their diet. So this is really another new frontier that we see in health information technology, of being able to remotely monitor patients. And what I encourage you to do is either to pause the video and to type in this web link and to watch a short video about remote patient monitoring, which shows how effective and useful it can be for patients who have complex medical conditions where real-time monitoring is desired, but perhaps it would be too expensive and not cost-effective for those people to continue to have that monitoring either in an outpatient setting or certainly in an inpatient setting. And so it allows for information gathering and real-time changes to the treatment plan because of the use of these monitoring systems.